I'm Dr. Naaventhan Palaniyappan. I'm a clinical associate professor in hepatology in University of Nottingham. So cirrhosis is basically scarring of the liver. So there is formation of scar tissue in the normal liver. The most common causes of the accumulation of scarring within the liver is due to the buildup of fat within the liver. And the two most common causes, especially in the UK, is one, mainly due to exposure to excess alcohol, and two is secondary to people or patients being overweight or obese or have conditions like type 2 diabetes or hypertension, what we would call metabolic syndrome. So those are the two main causes of accumulation of fat in the liver, and over a period of time, the fat leads to scarring in the liver. When the liver struggles to work with the accumulation of scarring in the liver, we would call that stage as decompensated cirrhosis. So the accumulation of scarring that now has led the liver to stop working. Some of the signs of this are accumulation of fluid in the belly, or bleeding from the gullet, from the varicose veins at the bottom of the gullet. So patients will be vomiting up blood or passing blood in their stools. So those are the signs of the liver struggling to work. And we would call that decompensated cirrhosis or advanced stages of cirrhosis. So in the UK, it is a big problem. So over the last 40 to 50 years, the amount of liver disease in the UK has quadrupled, and this is in contrast to other major diseases in the UK. So deaths from other major diseases has come down, but deaths from liver disease has gone up, which is worrying, and I think we need to do something about it. Addressing the risk factors for the liver disease is going to be one of the biggest way to tackle this, but we need to find new ways of treating patients who have already developed this advanced form of cirrhosis. And currently there are no available treatment that's widely available for patients with advanced cirrhosis. So patients with decompensated cirrhosis have a poor prognosis. So if you take 100 patients with advanced decompensated cirrhosis, approximately 50 of them will not make it to a year in the most severe form, and that is quite a stark statistics. Apart from the mortality, the morbidity burden is also quite significant. By that I mean the symptom burden. So patients with advanced cirrhosis, their quality of life is significantly impacted. So they have frequent hospital admissions. Their quality of life is affected by the symptoms they are suffering. So advanced cirrhosis affects patients both from in the length of life, but also the quality of life for these patients. So the mainstay of treatment is firstly to stop the damage to the liver. So for example, if the liver disease is caused by excess alcohol, stopping alcohol would be the first line of treatment. Even with stopping the damage to the liver, sometimes the liver does not what we call recompensate or recover its function. At that stage, the only currently available treatment is a liver transplant. So you're giving the patient a new liver from a donor. It is effective, but liver transplant is limited. So currently, patients may need a liver transplant, but they may not be fit to undergo a liver transplant because it's a big operation. And if they are not fit to undergo a liver transplant, then they can't have a liver transplant. And secondly, there's a limited number of donor liver that's available. So patients do wait on a transplant waiting list for a transplant. And while being on the waiting list, they certainly can worsen. And we know patients can die while waiting for a transplant as well. So although it's an effective treatment, it is not widely available and certainly not available to all the patients that we see with advanced stages of liver cirrhosis. So as I previously mentioned, the prognosis for patients with advanced stages of liver disease is very poor. Majority of these deaths from advanced cirrhosis occur in the working age. So we are losing patients in the midlife, in their working age. And certainly we need new treatment so that we can help this group of patients so that, hopefully we can reverse what's happening within their liver, for the liver to recover its function and to hopefully improve their quality of life and also save lives at the end of the day. Of course. So it's a very exciting study. So we are one of 8 sites in the UK that are participating in this revolutionary clinical trial. So this study involves taking patients' own white blood cells, so immune cells, harvesting them, and re-engineering it to make sure that it is stronger and lasts longer in their own body. And when it's infused back, so it's put back into the bloodstream, it promotes regeneration of the liver to reduce the accumulation of scarring and hopefully make the liver gain its function again to prevent any of the complications from cirrhosis or end-stage liver disease. The initial results from the previous study was very promising. So the previous study used just the immune cell without re-engineering it, and the results were very promising in terms of stopping complications from liver disease. And hopefully with the re-engineered white cells, the effects will be greater, and that is what we are looking to test. And the study is called EMERALD. So it's an EMERALD study, and it's sponsored by Resolution Therapeutics. So we've got excellent track record in terms of leading cutting-edge research studies, both in liver and gastrointestinal research. We host the Nottingham NIHR Biomedical Research Unit, and I'm part of the gastrointestinal and liver team as part of the Biomedical Research Unit. We've got world-renowned clinical academics who lead clinical studies and research in multiple areas, including metabolic-associated liver disease, advanced cirrhosis, drug-induced liver injury, among others. We are running several national and international clinical studies, and we are also participating in several national and international liver studies which benefit our patient locally, but also generating evidence to help patients with liver disease going forward.